This is where I think my experience ties, is that on the foundational level why this is happening, it's because these studies are all funded by the chemical companies, by the food companies. Like we've almost been, I think, misled by the experts when it comes to chronic conditions and when it comes to nutrition to take leave of our common sense. Like, do we need to wait for a double-blind, placebo-controlled, human randomized control study to know whether 0.5% of our brains being plastic is a good thing right now?
That's what the recent data is showing.
Do we need to have a human randomized control 10-year study to know whether an herbicide like glyphosate that's being sprayed on almost all of our food and our children's food, that people have to wear hazmat suits to spray and kills every single organism in sight? Do we need to wait for a study? Like we've just as the medical system is siloed, we've siloed all these questions and just taken leave of our common sense. Like animals in the wild, wolves in the wild are not getting like chronic rates of obesity, diabetes, metabolic dysfunction. Like, we're born with an innate sense of knowing what's good for us, of knowing that the sun is good, of knowing that steak is good, that broccoli is good. We can't overeat those things. The problem is we've been lied to by the professors at Harvard, at Stanford, at Tufts Nutrition School, that I believe are essentially, from my experience, PR for the food industry and the pharmaceutical industry that accepts all these things as a given. I mean, Tufts Nutrition School, 80% of their budget is from food companies. By our estimate, 50% of Stanford Medical School's budget touches pharma. So just fundamentally, like on the grassroots, like micro level, these industries have co-opted our institution of trust and led us to believe this. And you ask why we're the only people speaking out, because we've made it that evidence-based medicine really accepts all this disease growing and happening. And 95% of medical spending right now is on disease once it's happened. It's on managing conditions. And there's no higher levels of trust in our society than the NIH, than the FDA, than Harvard Med School, than Stanford Med School. So all of them are enforcing this. And then it's really just interesting where their emphasis is. Like, I was just reading the other day that California, the medical board, is checking the licenses of doctors, putting them under review if they write 5 vaccine exception notes. You literally are like on the verge of losing your license if you even go outside the orthodoxy on vaccines. But where is that level of emphasis? Where is that level of focus? Where is that level of rigor around metabolic health for kids, around nutrition for kids, right? I think it is a big deal, like, of kids getting polio, but like 50% of teens are obese or overweight right now. Like, we have prediabetes skyrocketing. Like, the medical system knows how to focus on something. They know how to tell Congress that there's no cost too high for something. Like, when it comes to pharmaceutical interventions, we're bankrupt the country with interventions once people get sick. Like I truly believe, and this gets to like the solutions and how I actually think this is an optimistic story, people waking up, why it's an existential kind of knife's edge we're on right now. We can change this really quick. The issue is that interests that profit from us being in fear, that just fundamentally is a statement of economic fact, profit from us being sick, profit from us being depressed, profit from us being infertile, they have co-opted our institutions of trust, and they've co-opted the clinical guidelines. Like, literally, when I was a junior employee, I helped co-file money to the American Diabetes Association. Okay? The American Diabetes Association says that if you have diabetes, you don't need to worry about your sugar intake. They say it's not tied to food. Right? The American Academy of Pediatrics right now is saying that if your child is overweight, slightly overweight, 12 years old, dietary interventions don't wait. It says do not wait to see if dietary interventions work. Ozempic. It's now being studied on 6 years old. The American Psychiatry Association, right? The psychiatrist, the standard of care. If your child is a little sad, SSRI, immediate intervention. Right? SSRI rates have doubled among high schoolers in the past 5 years, right? If your child's a little fidgety, the standard of care, right? It's not asking whether they're in the sunlight, not asking if they're too sedentary, not asking if they're being force-fed ultra-processed food, which would make any animal crazy if we subject them to what kids are subjected to. No discussion of that. It's just not in the clinical guidelines. So these doctors, these good people like Casey, go into the medical system. We're this magnet for smart people. We get them in for the right reasons. There's easier ways to make money. But they come in, and they get saddled with one skill, they get saddled with a bunch of debt, and then they're realizing this is a rigged system. Few people, unfortunately, had the courage like Casey to drop out. I thought she was an idiot. I was like, what are you doing? We were kind of brainwashed to do the traditional system. I couldn't believe it. We didn't talk for a year. But it just is hard for people to understand that you can walk away from this because our society stamps these credentials on people. Like, what's better than being the dean of Stanford Med School. The dean of Stanford Med School right now was Casey's same specialty, head and neck surgery. And the way you rise up in medicine is you do a specialty, you focus on a couple inches of the face, and then he focused on a fellowship on an even narrower part of the body. Like that's how you rise up. You've siloed the situation. Anything that's not siloed is considered not scientific, is considered wacky. They've called us the woo-woo caucus, talking about these nutritions. The medical system enforces this siloed view where diabetes, heart disease, depression, kidney disease, cancer, they're all separate things. If you have those conditions, you're seeing 5 separate doctors, they're not speaking to each other. That's very profitable, very problematic. So the solution is truly just having the clinical guidelines of how diseases are assessed and how they're intervened changed to following the science, which is these are metabolic conditions. 90% of the U.S. medical budget is tied to managing preventable and reversible lifestyle conditions. If we had people on Medicaid, instead of jamming with the statins, jamming them with Ozempic, jamming them with SSRIs, lower income people were going bankrupt from Medicaid, $1.3 trillion. It's growing. It's a bigger part of the budget than the defense budget. If we literally just asked, how do we have that money to spur thriving, to incentivize exercise, to incentivize healthier food for these folks, we'd be a transformed country. It's literally that simple, but it takes that moral courage. It takes Americans actually saying, no, I am going to go against the NIH. I am going to ask questions. But of course, we have violent, I was just reading, back, what was it, 2022? Like every single public health official in America said you were like the enemy number one for talking about sunlight and talking about food and talking about healthy eating. COVID was a metabolic condition. COVID was a foodborne illness. Like if you were metabolically healthy, you did not die of COVID, like pretty demonstrably. And you were threat number one.